All right, it's a pleasure to have you with us. And this is indeed a pleasure because we have a medical perspective and yet the very human perspective. We've got survival and we've got science, all right? And beyond that, we have a doctor and a patient. So I think it's incredibly special for all of those reasons. And Chhavi, I want to kick off the conversation with you. What we keep hearing and what we've heard time and time again this afternoon is that every 4th minute, a woman is diagnosed with breast cancer. And we just witnessed Take Charge, essentially the unveiling of a new initiative. If you were to go down memory lane for a moment, and if you were to retrospect and think about when you initially received your diagnosis, how might initiatives like Take Charge have approached or essentially influenced your entire approach to your recovery? Very curious to understand.
So this, first of all, thank you so much for having me. May I please request a little bit of silence in the audience because at certain moments I can hear you guys more than I can hear her. Gets a little difficult to comprehend the question and I'm trying my best to answer this one.
Absolutely.
So when you talk about taking charge, if you ask me at that point, it's not something that you can identify in the moment. It's always something that you look back in retrospect and think, okay, yeah, this step that I took at that point was me taking charge. So I think the first step that I took, which I think was me taking charge, was understanding that this has happened. I think that acceptance of what has happened was the first step because initially I kept trying to think that no, there must be a mistake. That there is it's wrong, you know, it cannot be right. Then sometimes it happens, you know, we all watch Bollywood movies and we feel, kuch to mix up hua hoga, ye meri report hai hi nahi.
Ji, bilkul.
So that happened and then I thought that maybe I did something wrong in my diet, maybe something was wrong in my lifestyle that this happened and maybe if I can just reverse that, it can just go away. But then wisdom prevailed and I thought that even if I want to try alternative methods and you know, try to take care of my diet, the first thing that I need to do is accept this and ask my oncologist the right questions. So I've literally bombarded him with different questions. I'm sure, doctor, you must be feeling, meeting the patients like me every now and then. I asked him what the treatment options are, why this and why not that. And the most important question that I asked him was, what next? Because you here are telling me that I'm going to be cancer-free for sure, but how's my quality of life going to be after I'm cancer-free? Is it going to be the same or am I always going to be labeled a cancer survivor? While I'm very proud to be labeled a cancer survivor, there's a different fun in accepting that I'm Chhavi version 2.0 and I'm much stronger than I was before. So that is the charge that I took at that point. And after that, during my journey, the most important thing that I recognized was that no two cancers are the same. So no two reasons why somebody gets the cancer. The same cancer are also the same. They're always different for different people. There is no, I think there's no proof in medical science that why this person has a cancer and why the other person with the similar lifestyle doesn't. So to recognize what could have gone wrong in my life so that, you know, it doesn't come back was something that I was trying to introspect. I still don't have all the answers, but I try my best to, take care of my lifestyle, you know, wake up at a certain time and take care of my diet in a certain way. And that, I think, is me taking the step to be proactive.
Chhavi, thank you so much for sharing that. It's deeply personal. It's not easy to share, and I think your candor really moves us all. And if I've understood you correctly, it was essentially a multi-step process, but the first step was coming to terms with the fact that this has happened to you and answering the question, why you, to which, of course, there are no answers. And then the second step was to essentially regain control, getting the information right at your fingertips, asking the questions such that you could take charge of your own recovery, right? So against that backdrop that we've just heard, you know, Dr. Sumant, of course, it seems that recurrence of breast cancer occurs in 10 to 50% of cases. That figure is, of course, staggering. All right? So you're in the incredibly difficult position of helping patients cope with the fact that, all right, there is this fear that's always looming in the backdrop, and yet they need to continue to live their lives to the full extent. How does one possibly strike that balance?
So I think The initiation, Chhavi ma'am has done a very beautiful discussion. First and foremost is when the patient has a disease. So that is the lightning kind of a thing. The lightning strikes. Why me? Why not anyone else? I have not done anything wrong. Whatever I have done, everyone else is doing.
Right.
So that is one of the first things. Going through the journey as a smart patient is something we as oncologists always welcome, and we are very happy to have our patients who go through whatever is being told with good discussions and like a democratic process. Yes, in breast cancer, there is a chance of recurrence. I think this time, the patient, it's like she said, Chhavi 2.0. So it's a Chhavi 2.0 living it. So she's not scared of the disease. She knows what is happening to her, what has happened to her. And if we talk about recurrence, yes, there is data that up to 25-30% patients in early breast cancer also can recur. But again, we have to understand there are two aspects of it. One is the disease biology itself, that what kind of breast cancer was it. You have different kinds of breast cancer, both on the luminal levels or on the levels of the estrogen, progesterone receptors, and lots of those things. And
right.
Yeah. And the second part is what I can do to stop it from coming back. So what is inherent, the doctor is taking care of it by giving beautiful medicines and whatever new innovations are happening. But what I can do. So as a survivor, or as I think the better word is Yodha, which you become in your 2.0, you have to be aware that the first 5 years are the only major crucial years when the disease tends to come back. So that is why in cancer we always talk about 5-year recurrence rates.
Right.
So after 5 years, you are mostly equivalent to a normal person, the chance of getting a cancer back. So I think what we have to do, and which has been scientifically proven, is that we have to follow 4 or 5 small dictums. One is controlling our weight and doing regular exercise, because the data is clearly showing that if your BMI is normal, if your body weight is normal, and if you're doing around 30 minutes of regular exercise per day, then your chances of getting a cancer coming back becomes less. Similarly, diet is something which has to be balanced, not too much binging on carbs, which has again been scientifically proven. And the third most important part is abstinence from alcohol and tobacco. So I think if we are able to manage that, so in totality it is nothing but the same thing which we always say, a healthy lifestyle. So if you're having a healthy lifestyle, I think we'll be able to cope up with it, and we'll have a beautiful 2.0 life with us.
Well, speaking of 2.0, and I want to, take it back to you now, Chhavi. I think what's often overlooked in the conversation around breast cancer survivors is their ecosystem, and that includes their ecosystem of caregivers, right? So if you could walk us through the role that perhaps your caregiver played in your story of recovery, whether it's managing your medical appointments, helping you make more informed medical decisions, or simply being a quiet voice of strength, which is priceless.
So I think, first of all, I feel cancer is not a disease which is an individual disease. It's a disease which happens to the whole family. So caregiver becomes extremely important. And so I think there's a step-by-step role that everybody plays in a cancer journey. First is the doctor, who's going to treat you, do your surgery, tell you this is medicines, what you have to have. Second is the caregiver, who's going to actually make sure that you do all those things and have what you need. And third is you yourself, because it's your journey. So a caregiver's journey also is different for different caregivers, just like a cancer journey. So depending on what the patient needs is what the caregiver journey looks like. In my case, I think for the first 3 months, were the hardest after the surgery for me. And it was difficult even for me to understand what I wanted,
right,
what I needed. So obviously it was that much more difficult for my husband to understand what I needed. But I know that my journey was, it was not just a cancer journey. It was also a journey of me rediscovering myself. So for him to allow me to go on that path without a worry was the biggest strength that I could have ever expected, because there were times that I just wanted to run away, and I would just tell him that I'm taking off for 2-3 days, and he would be just, okay, you go, do what you need, take the time, don't worry about work, don't worry about kids, I'm here.
Incredible.
I don't know mentally what he went through, because he never told me. I told him everything that I went through. So I think that's probably the only thing that he could do during that time, but that was the most important thing that I needed.
What an incredible pillar of support, right? And, another point that Chhavi brought up earlier in the conversation that really struck me was that one doesn't just want to be labeled as a cancer survivor. What they're most concerned about is quality of life, right? Is their 2.0 version of life going to resemble their former self? How do you guide patients through that journey?
Yeah, so quality of life is something which has evolved as the main endpoint of all cancer treatments. Earlier, when cancer treatment started or when the clinical trials were designed, it was designed on overall survival, it was designed on progression-free survival, that how long the patient will remain disease-free. But right now what we have been discussing, or right now what the dictum has become, is quality of life. So quality of life is something like, someone intelligent like her, she says, I want my life back and I want it to be as good, as beautiful as it was before. So quality of life is definitely one of the best index for cancer treatment. So coming back from the thing she started, surgery. Now we are getting into smaller surgical fields. We are able to get into breast conservation surgeries where the, I'll say, the defacement of the body is the least. So that is one important part of breast cancer. We try to avoid these topics. Even patients at times try to avoid these topics, and we have to like jam it into them that you talk to us. You don't have to just tell us, just remove the breast. No, you have to understand what disease you have, how we can conserve it, how we can maintain your body structure. The second aspect came with drugs. So I am a medical oncologist. So medicines or chemicals means chemotherapy, which are used to treat. So nowadays, the biggest invention, I think, in cancer chemotherapy was a simple tablet for nausea vomiting. I think Chhavi might have used it, which was called as MCET or ondansetron. 20 years back, it was not there. Think of people, how they were suffering. So now, even the nausea, the vomiting, major problems are not there. So we have skull cooling caps which we can put on the scalp. The hair can be safe. So basically medical oncology has evolved. It has evolved from a branch which was more like a destructive branch to something very constructive, very beautiful. And we try to preserve the quality of life. So oncology it was a Trishul branch. So you had a medical oncologist, you had a surgical oncologist, and you had a radiation oncologist. But now it has become a holistic oncology. So it is not only oncology, it is psycho-oncology, nutritional oncology, everything interwoven into one thing. So a cancer center is incomplete till you have a comprehensive, collective group of people who are able to give you a complete holistic solution in cancer.
It sounds very multidisciplinary.
Yes, it is.
And all science aside though, Chhavi, as a public figure, you really add a human lens to the conversation. So, for your fans, your followers, or even the ordinary layman out there who may be facing a similar situation that you are in or you have faced in the past, what words of wisdom might you have to share, or how might you better separate fact from fiction? Because, your voice carries so much weight.
I don't know about words of wisdom, but I think one thing that I can say is that for the longest time, because I was talking, like Doctor, you also just mentioned, quality of life, it is so important nowadays. I kept focusing on going back and living the same life that I was living before cancer. I remember that I had I had an injury which I went to get tested and the cancer was diagnosed. It was just by fluke. But the injury happened while I was doing a pull-up. So my only concern was, will I be able to do a pull-up again? That is my quality of life that I want back, right? I think spiraled down into depression because obviously when I came back home after the surgery, I could not even lift my hand 5 degrees. So it was something which was maybe something which was going to happen in the future, and the doctors told me that you can't lift more than 5 kgs. And I said, 5 kgs, matlab what? Bicep curl 5 kgs or deadlift 5 kgs? What? 5 kgs what? Nobody had an answer to give me.
Right.
And I think it took me a few months to understand that my quality of life is going to be good, but it's not going to be compared to what I was pre-cancer. And I'm glad I stopped making that comparison. And this is what I would like to tell everyone. Don't make that comparison. Just take one day at a time. Rather than thinking, one day I'm going to do a pull-up, you can say, okay, today is day 1 from the time, I will eventually get there. And that's why I'm 10x of what I was before cancer, because I'm so glad I stopped comparing. I just took one day at a time. Otherwise, I would have just been stuck in the same Chhavi, not 10x. So yeah, there's no defining how much more you can be just because you fought cancer. I think that just adds so much more to your what you achieved.
That is so beautifully put, and this is not easily shared. We really admire your strength, and we salute you, Chhavi. And coming to you now, Doctor, since Chhavi has added the human perspective from the medical perspective, what is it that you'd like to share, with our audience, with our viewers, in terms of separating not just fact from fiction, but debunking so many of the myths that surround the disease?
So coming to the myths, I think basically we have to start at 2 or 3 things, which I think people like Chhavi should help us in doing this, because biggest myth which is oncology community has to face is that biopsy spreads cancer. So I use this stage to bring it to all the people that biopsy does not spread cancer, and it is the most essential part to plan your treatment. So basically what we discussed today is cancer treatments have evolved, and you'll be a equally equal or better person by the time you evolve from this treatment. So do not get scared. Just go through your treatment with the advice of your oncologist. And I think the world is very bright on the other side.
All right. And when we look at Chhavi 2.0 and your plans ahead, your aspirations ahead, right? It seems like, you've certainly on the other side of that dark tunnel, and there's a bright future ahead. What does that look like? And to what extent does this term breast cancer, or what you're coping with, factor into your everyday thinking and decision making? Or do you essentially believe that this is a bigger, better, brighter you?
Absolutely. I think breast cancer is the best thing that happened to me, because I would never have gotten out of my comfort zone and did all the things that I'm doing today because I was very comfortable. I was just so comfortable in the life that I was living. Sometimes I feel that life has a path for you, and you need to be jolted out. And it was just that. It was just that for me, because it was stage 1. It was grade 1. It was diagnosed just by fluke. It was just that nudge that I needed at that point, and I got it. And I also want to talk a little bit about the fear of the recurrence that the doctor was also speaking about, that breast cancer mein hota hai na, zyada hota hai. But my point is that as a healthy individual, you spoke about a good lifestyle. I had a great lifestyle even before I got cancer. I was healthy. I was always exercising, giving time to my health. I was particular about my diet and everything. I had healthy pregnancies. I breastfed both my babies. And still I got it. Yeah. So if it recurs, it recurs. I just want to put it out there that fear should not be like a dangling sword, that what if? Because even the first time, what if? I mean, I'm a huge believer of faith, and I feel faith is something which should be so strong that when we leave our house in the mornings, sitting in our car, heading towards a destination, the fear of meeting with an accident never even occurs to us. That's what faith is. So there's no point in manifesting that by just being fearful about it. Hoga to hoga, dekhenge. And medically, we've made so much advancements today. I was very, very happy with the whole treatment that I went through. Doctors were so supportive. Medications were so good. They just scared me a little bit in the beginning. Ye side effect, wo side effect. But thankfully, everything was great.
Oh my goodness, such moving words. And, doctor, when you hear a breast cancer survivor say that breast cancer is possibly the best thing that ever happened to me, to what extent does that move you as a medical professional? Yeah,
so this has been the journey. I think as an oncologist, our biggest friends are our survivors, our yodhas. So I'm really happy, and I'm the more of it that Chhavi, being such a big influencer on the society, she's bringing out these topics. It matters a lot to us, and I think she deserves an ovation, a standing ovation for that.
Standing ovation. Let's have it, ladies and gentlemen. Let's have it. I think it's deeply deserved.
Thank you.
This is a story of truth, of survival, of strength, of resilience. And it's happened to one of our very own. All right.
Thank you so much. You can say this was just a test to know if you haven't gone off to sleep. Glad you're awake.
Don't open the secrets.
All right. And then I think by way of closing comments, and I'll pose my question to the both of my panelists here. All right. I think, oftentimes there is a delay in prognosis. Okay, or detection. Like you said, you discovered your diagnosis by chance. But oftentimes, even in the wake of symptoms, there is a hesitance. Concerns loom on one's mind, such as being a financial burden on one's family. All right? Fearing the diagnosis in the first place. Not knowing the best course of action. Thinking one has to die one day anyhow. If you start to get in that zone of where your thoughts are doomed, or it's a very daunting time, what might you say to that person, both as a fellow survivor and as a medical professional?
Doctor, you first.
Okay. So I think 2 things. all cancers are not same. Everyone, each body, each cancer is different. So we are not supposed to get scared and not take too much of influence from other people who have gone through it. And yes, the science has progressed so much that yes, you will win over this. So you will become a cancer warrior, you will become a cancer yodha. So don't worry, go to your doctor.
All right. And to the yodha over here.
So yeah, no two cancers are the same. In fact, I just want to talk about a little experience that I had when I came out with my cancer diagnosis. I was bombarded with a lot of messages from fellow patients and people who were fighting and survivors. And I read some really horror stories. Yeah, I mean, I was very, very touched reading those. But after a point, I stopped reading because I didn't want to have that fear in my own mind and I didn't want to manifest it. And I decided that my journey is going to be my own journey and I'm going to make my journey. I'm not going to let my journey depend on somebody else's. And I think that positivity and that faith is what helped me a lot. And having said that, don't underestimate the importance of regular checkups, because वो बोलते हैं ना कि have faith in God but lock your doors. It's just like that. Have faith in God but don't forget your regular checkups.
All right. With that, I think that makes for a wonderful note upon which to close. Dr. Gupta, Chhavi Mittal, huge round of applause for both of our panelists.
Thank you so much.
All right, and can we please have Pooja Sethi on stage to felicitate both of our panelists? All right, thank you so much for sharing that. Thank you, Chhavi, that was wonderful. Thank you. Thank you, thank you, thank you, thank you. Thank you. Thank you so much. A token of our appreciation for sharing your stories with us, sharing your insights, your wisdom, and adding that very human lens to the conversation. Chhavi Mittal 2.0, ladies and gentlemen, our yodha right here. And to Dr. Sumant Gupta.